Good afternoon, everybody, and thank you, everyone. I am privileged to be here in front of you, like august audiences. I'll be talking on a very common topic, that is obstructive airway disease. Mostly, we know that asthma and COPD. All of us, not many, all of us, we normally prescribe inhalers. But I will be disclosing some facts and how do we make it better for the patients. So with no more delay, I am sharing my slide. The topic of discussion is adherence to inhalation therapy. Mostly people do not adhere. I hope all of you are agree. You prescribe inhalers, they take inhalers, and they do not do the follow-up. There is no chance to know that whether he or she is using this inhaler or not. And obviously, again, when they come normally in exacerbation, it's a problem. But if they know the etiology and the actual cause of the problem, what is the actual problem, they will be more conscious and may use the inhaler. So before that, before making the patients aware, we should be aware ourselves. So I should go further. What is adherence? That means three important points: taking medicine every day as prescribed, and using correct inhaler technique, and lastly, not stopping without medical advice. But what we actually see, they do not take it every day, maybe of their wish. When they think that they should take, they take, otherwise they stop. That is the biggest problem. Technique, correct technique, say all over the world, it's a global issue. Mostly the patients do not take it the right technique. They do not know actually. Not in India, everywhere in the world actually. And they stop themselves. These are the problems which address. Sorry. That means adherence means therapy refers to how consistently and correctly a patient follows the prescribed inhaler regimen, which is critical for many, that is asthma, COPD, and other obstructive disease. Lastly, the next on 6th of this May of this year, that was World Asthma Day. The GINA has already given the importance of inhalers. The theme of this World Asthma Day was make inhaled treatments accessible for all. That means it is the mainstay of therapy, and that should be taken properly. But some facts we should know. There are some studies. The problem of all the patients, even the healthcare providers, all of us have the problem because we actually do not follow the right technique, and we have to improve on that. What the study shows, in the conclusion, you can see the 3/4 of the US adults with obstructive airway disease, they take the MDI, that is metered dose inhaler, incorrectly. So we should give more importance to know that right and correct technique. And another paper also justified the same thing. There is a problem. And what about the doctors and nursing staffs? The same thing. They are not properly aware of the proper technique. It's a global issue. And another study is there. Healthcare professional demonstrated inadequate knowledge for the proper use of inhalers. The poor understanding of the correct use of these devices may prevent these professionals from being able to adequately assess and teach proper inhalation therapy technique to their patients. That means that today's discussion is basically meant for upgradation of our own knowledge so that we can provide it to the patients at the rightly. Gold and GINA guideline also justifies the same thing. The studies there, you can see that even the patient normally what they think, they know, as because they have known something, they know that they are taking the inhaler rightly. But you cannot make them understood that you are not following the right technique. You just listen and learn something. They know everything. Study also the same thing. The 94% they do the error. So again, we should be cautious. The challenges of the healthcare professional, what is that? The lack of time. We are actually busy. We address many patients, so individual time to the patients is very less. So that is the biggest problem of us. And we have actually untrained demonstrator as assistant. They are also irritated. They manage different things, so they cannot focus on a particular patient to teach it properly. and lack of proper knowledge of healthcare professionals themselves also, as I mentioned just now. Then there are some common mistakes. We have mentioned many mistakes, namely in this slide there are 10. You can read it. Not using the right technique of the inhaler, already mentioned. Not using a proper spacer device for MDI. Meter dose inhaler, when you make a puff, the velocity of the puff is, I'll show you in the next slide, the huge velocity. To reduce the velocity, we need a spacer. But many of us, we do not use the spacer. We should use it. So MDI must be used with a spacer device, not breathing out the lung fully before inhaler. It is a common mistake. They do not exhale before taking. So there is no drug deposition rightly. Forgetting to shake, it has to be shaked before the puff. Not lifting the chin, that should be, if you take it this way, that will not go to the lung properly. So there is some tilting of the neck is also required. Breathing too early and too fast. If you do too fast, again problem. If you do slow, again problem. That's optimum speed of taking inhalations should be done. Not waiting between puffs. Between two puffs, there should be 1 minute pause. But even the patients do two puff. Doctor has told two puff. They do the puff twice instantly. Again, that is wrong. A lot of things are to be improved. Not having a tight lip seal. The lips should be sealed so that the external air not come into the lungs. Not holding the breath. Breath should be hold for at least 10 seconds. If possible, if not, at least 5 seconds. But they do not hold it. And not rinsing. There are side effects. They do not rinse it. There should be some fungal infections. Again, there is a problem of non-adherence. They stop inhaler. If you take inhaler, there is ulcer in the mouth. So they do not stop, not knowing the reason, but they think that the drug is causing that problem. So again, problem. Sorry. Another some mistakes are mentioned: sitting down, using empty. Even it is very frequently seen that drug is already out. Only the propellant is there. They are taking it because with our mentality is to use the gas. Even the cooking gas also. The gas is empty. They are trying to do something and another 2 or 3 extra days. In this way, maybe the same habit. The drug is already empty. They are taking, and there is no medicine at all. So there is some exacerbation, maybe an acute attack may present with this. So sitting down and using empty inhaler, not checking, already mentioned, not using spacer, already mentioned. There are a lot of things, the repetition, but this is the points to be addressed very consciously to give the optimum treatment. Common mistakes, and they do not take the inhaler with suppose most of the inhalers nowadays twice daily. They think once daily I am okay, so once daily they do not do the second dose. So forgetting to the preventer inhaler the same twice daily or whatever the dose is there. Forgetting to take the reliever inhaler. If the patient is on inhaler, see he is going outside, he or she should bring the reliever inhaler, but they do not carry this, so there may be some attack. So one thing, the inhaler we cannot prescribe it randomly. That should be customized for the patient, for educational background, monetary, the knowledge, even the build, everything. So before prescribing an inhaler, we should be knowing all these things. So inhaler should be customized for the individual patient. Asking patients to demonstrate, it is a mandatory. But if you you will take this way and they go out, they cannot follow. So ask them to show the technique they are following. So asking patients to demonstrate how they take their medication is more effective than showing them only. And that is a problem, but we don't have the time actually. And these are some wrong techniques. There are many wrong techniques, I know, but all of you know, but I have already expressed some of them. They are taking like a body spray, etc. They do not seal the lip, etc. in the reverse direction, so there will be no medicine. Today also I have come across in my clinic, they are using the wrong revert it. These inhalers should be taking this way, they are taking that way. So no medication is coming out. So as I mentioned, the speed of inhaler more than 30 meter per second. That means 108 to 360 kilometers per hour. The speed the drug is coming out, and that has to be. They cannot take the drug inside the lung. So that speed should be reduced by using a spacer device. The correct technique. There are a lot of points are there. Set or assemble the spacer. I am mentioning only the MDI. DPI is different technique. Set or assemble the spacer, sit or stand erectly, comfortably. Shake the inhaler beforehand to 5 to 10 seconds. Breathe out fully to empty the lungs. Then place the mouthpiece in the teeth and seal it with the lips. Press down the canister to release the puff. Then continue to breathe slowly and deeply, not fast. I already mentioned, and for at least 3 to 5 seconds. Hold the breath for 10 seconds. It's mandatory. Breathe out slowly through the nose and wait for 1 minute before the second puff, and repeat the same procedure for the second puff. Okay. Common barriers to adherence. Poor inhaler technique. If do not take the medication rightly, so there will be no relief. So patient will lose interest. Complex regimens. Many prescriptions are, we can see that there is some DPI, some MDI, some sort, a lot of confusions. So it is have to be taken care of. Complex regimens, avoid complex regimens. Multiple medication, lack of understanding, then side effects, fungal infections, etc. There are a lot of side effects are there, but only fungal infection is very common. Cost issue. High cost, if you prescribe the medication, the high cost value, then they can purchase for that month, but may not refill it in the coming days. And basically, when the symptoms are controlled, they forget to take the inhaler. It's very common. Even we also forget. We also forget our medicines. So these are the points to adhere, barrier to adherence. So how to improve it? Education and training, only thing. If I educate the people and give the rigorous training, repeated training, then only we can improve. So repeated demonstration is required. Assessment of inhaler technique. If we say the patient, let us show, let me show the technique, then we can correct the steps if they do the wrong thing. Simplifying regimens, reminders app. Patient cannot remember. So there are some nowadays there are some apps is there to remind you, or the inhaler is there. So there is some digital inhaler also. You can, if you miss the dose, then you can check it out. Motivational interviewing. If somebody committed the mistakes and get the some adverse effect, if you take a snap of this or video, you can show the other patient, they can correct themselves. And addressing beliefs. There are a lot of myths about inhaler that should be addressed. And regular follow-up. The patient do not do the follow-up once they get the symptoms controlled. So there is a problem. These are the things to improve. There the DPI device. I have not mentioned the technique, but it is relatively easier steps. But so I should not mention. And I already mentioned this point. Use reminders app. Keep inhaler with you. Refill on time. Patient do not refill it. Once it is empty, they are searching for the other things. When they go to the medicine shop, there is no stock, so cannot refill. So there is a lot of gap in between. And the patient may end up with emergency visit. So that should be taught them taught them. Okay, and helpful tips. Spacer device already mentioned. Practice correct technique. Remember, inhale should be slowly and deeply. This is the main important point. You can check the pharmacy records if it is possible. Electronic device, that means there are many inhalers available in the market. You can track the doses. If you do the good adherence, there are a lot of benefits are there. Fewer symptoms, that means symptom control. That is the target of therapy. Like wheezing and shortness of breath is reduced. So patients do the normal activity. Better control of the condition. They can do the job they can do their own job. Fewer flare up and hospital visits, and improved quality of life. That should be our target. And of course, this picture shows that end up smoking. If you follow all the steps and patients are doing they are smoking, so symptom will not be relieved. So they will cut the inhaler. Inhaler is the no action of the inhaler, but they are doing the thing that aggravates the situation. So every visit you should focus and insist on stop smoking. So I write actually in the prescription SSC, very common term in our days in Bengal, School Service Commission. I mention it, stop smoking completely, my SSC. So encourage it. Sorry. And flu vaccine. I hope all of us will prescribe it, but it is an enormous effect to control the exacerbation. So do not hesitate to prescribe them. flu vaccine, annual seasonal flu vaccine. Then that helps in exacerbation, prevent exacerbations. So there will be inhaler plus stopping smoking, stop smoking, and flu vaccine. All this together, then their quality of life will be improved. So they will have faith on that particular treatment. That is the mainstay of therapy already mentioned. So before ending, I should share one quotation. The one famous person already did it. That is, people don't care how much you know until they know how much you care. অলরেডি রিটেন থিওডোর রুজভেল্ট, তিনি এটা বলেছিলেন, বাংলাতে শেষ করছি, যে আমরা অনেকে জানি, অনেক কিছু জানি, কিন্তু আমরা কতটা পেশেন্টদেরকে বা অন্যকে দিতে পারি। তাহলে আমরা যদি বেসিক্যালি এই যে অ্যাডিয়ারেন্স নিয়ে কথাটা বললাম, তো অ্যাডিয়ারেন্সটা তখনই হবে যদি আমরা কেয়ার করি। ইফ উই ডু কেয়ার, দ্য পেশেন্ট উইল অ্যাডিয়ার। উইথ দিস ওয়ার্ড I should conclude. Thank you everyone for nice listening. আমার এইটাকে একটু বের করে দেবেন, আমি নিয়ে যাবো, আমার টাইম হয়ে গেছে।